Hi, this is Susan Alexander and it's the Funky Friday Anatomy Quiz. This week we thought we'd try a new formula and we actually went live on a live recording. And whilst most of it went well, there were a few technical issues, some to do with the internet. So I thought what we'd do is pre-record this so that you get the better version of it. So with that being said, I'm going to jump into our new formula. Is what we're going to try and do is we're going to try 10 questions, and they're all going to be true-false questions, and 2 upper limb, 2 lower limb, 2 head and neck questions, and 4 questions related to the thorax, abdomen, and pelvis. So with that being said, let's go and try the first one. So the brachial artery lies medial to the median nerve in the cubital fossa. Is that true or false? Remember, you can stop the video at any time to take time to think if you need to give it a bit of thought. So does the brachial artery lie medial to the median nerve in the cubital fossa? The answer is false. Now, the cubital fossa is a space found on the anterior aspect of the elbow joint, and it has 2 muscular boundaries and an imaginary line. So the lateral boundary is formed by the medial border of the brachioradialis muscle. The medial boundary is formed by the medial boundary of the pronator teres muscle. And there is an imaginary line between the 2 humeral condyles. So the lateral boundary is the medial border of the brachioradialis. The pronator teres forms the medial boundary. And then there's an imaginary line, so you can see here the triangle. And when you look closely, you can see that the median nerve lies medial to the brachial artery. Next question. The thoracodorsal nerve is a branch of the posterior cord of the brachial plexus. Is that true or is that false? The thoracodorsal nerve is a branch of the posterior cord of the brachial plexus. The answer is true. Now, there are 5 branches to the posterior cord of the brachial plexus, and the brachial plexus is formed by the union of the posterior divisions of all 3 trunks. There are 5 branches, and I use the mnemonic stars. So S at the first letter of the word stars, and the last letter reminds me that there's an upper and a lower subscapular nerve. Next is the thoracodorsal nerve, the axillary nerve, and the radial nerve. And if you look at this diagram here, you can see that the muscles that are supplied by the posterior cord are the deltoid, the latissimus dorsi, and all the muscles of the posterior arm and forearm in the extensor compartment. So if you'd like to have a really good and easy way to draw the brachial plexus, if you follow the link below, there will be a link to a PDF that you can download as a gift from us here at the Funky Professor to you, which will really help you learn and draw the brachial plexus. There are also 2 awesome videos which I highly recommend you go and see, and we'll put links to those down below as well. So the next question is the talus. Does the talus articulate with the intermediate cuneiform bone? Is that true or false? Does the talus articulate with the intermediate cuneiform bone? The answer is false. The talus articulates with the navicular bone, and it's the navicular bone, which is this one here, that goes on to articulate with the intermediate cuneiform. In fact, it articulates with all 3 cuneiform bones. The next question is the hamstring muscles. Do they arise from the body of the pubis? Do the hamstring muscles arise from the body of the pubis? The answer is false. The hamstring muscles actually arise from the ischial tuberosity, which is part of the ischium. Now, the pelvic bone has 3 bones. It has an ilium, an ischium, and a pubis. And so if I could show you here, this is the ischium on the left-hand image where the hamstring muscles attach, and the pubis is on the right-hand image. You can see they're nowhere near the hamstring muscles. Now, there are 3 hamstring muscles that take their origin from the ischium. These are the biceps femoris, which goes on and inserts laterally onto the head of the fibula, the semitendinosus, which inserts medially, and then the semimembranosus, which also inserts medially. And if I can click onto the next page, what I wanted to show you is that the pubis actually gives attachment to the adductor muscles. So these are the adductor longus, which is in the middle here, and the adductor brevis. The adductor magnus comes from from slightly further around on the pubic bone, but this is the body of the pubis here. Now, the head and neck question we kick off with: does the middle meningeal artery, is it a branch of the internal carotid artery? Is that true or false? The middle meningeal artery, is it a branch of the internal carotid artery? The answer is false, because it's actually a branch of the external carotid artery. And I thought I'd show you how we get to that stage. So the middle meningeal artery is actually the first branch of the first part of the maxillary artery. The maxillary artery is found between the neck of the mandible and the sphenomandibular ligament. Let me show you how we get to that. So we start off with the common carotid artery, which divides into the external carotid artery and the internal carotid artery. The external carotid artery goes on to give off the maxillary artery, and it's the maxillary artery that gives off the middle meningeal artery. So the middle meningeal artery is a branch of the external carotid artery. And just to show you where the internal carotid artery is, I have put up this diagram so you can quite clearly see that the external carotid artery and the internal carotid artery are quite different. Next question. The lateral wall of the orbit is formed by the greater wing of the sphenoid bone. Is that true or false? The lateral wall of the orbit is formed by the greater wing of the sphenoid bone. True or false? Well, the answer is true. And in fact, here's a picture showing you all the different facial bones in separate colours. And there are, in fact, 7 facial bones that form the orbit. These include the frontal bone, which is in yellow, the sphenoid in bright pink, the zygomatic bone in dark green, the maxilla in the light blue, the lacrimal in the dark blue, and the ethmoid in the light green. And if you look really closely there at the middle, at the base of the orbit there, you can see the palatine bone. Now, the orbit is described as having a roof, a lateral wall, a floor, and a medial wall. So it's like if we go around in a circle. So let's start with the roof. The roof is formed by the frontal bone shown here in yellow, and the sphenoid, which is shown in pink. The lateral wall is also formed by the greater wing of the sphenoid and the zygomatic bone, which is in dark green. The floor is formed also by the zygomatic bone and largely by the maxilla, which is in the light blue, and the palatine bone, which is that little bone there at the floor there in red. And the medial wall is formed by the maxilla, the lacrimal bone, which is in blue, the ethmoid bone, which is in light green, and a little bit of the sphenoid bone. So the sphenoid bone actually gets in three of the regions there. Oh, now let's move on to the abdominal section, abdominal pelvic section. So the pancreas, does it lie anterior to the abdominal wall? Is that true or false? The pancreas lies anterior to the abdominal aorta. The answer to that question is true. The pancreas does lie anterior to the abdominal aorta. Here is an anterior view showing the stomach and the duodenum, and you can see the pancreas nestled into the curvature there of the duodenum. Now, if we look at a lateral view, it's much clearer here that you can see that the abdominal aorta lies just in front of the vertebral column, and in front of that is the pancreas. Next question is, 4 pulmonary veins enter the right atrium. So do 4 pulmonary veins enter the right atrium? The answer is false. Here's an anterior view of the heart, and it's actually, if we turn it round, we can now see that there are indeed 4 pulmonary veins, but they enter the left atrium, not the right atrium. the superior and inferior vena cava enter the right atrium, but it's the pulmonary veins. And you can see here that they're in red because they're bringing oxygenated blood back from the lungs into the heart to the left atrium to be pumped through to the left ventricle and then through the aorta and around the body. Next question. The greater omentum contains branches of the inferior mesenteric artery. Is that true or false? The greater omentum contains branches of the inferior mesenteric artery. True or false? Well, the answer is false. And in this diagram, we're looking at the posterior view with that abdominal aorta again. And there's the inferior mesenteric artery, and the colon and the small intestines have been grayed out. But you can see that the inferior mesenteric artery gives branches to the colon, the descending colon, the sigmoid colon, and down to the rectum. And you can see here on the actually, I've got those labelled incorrectly. On the left-hand side is the posterior view, and on the right-hand side is the anterior view. And you can see the greater omentum there draped down from the greater curvature of the stomach. And if we turn it round so you can see the lateral view, you can see that, in fact, the inferior mesenteric artery does not send branches to the greater omentum. Please forgive me, that is the anterior view there. And the final question, the levator ani, or ani, is one of the muscles of the pelvic diaphragm. Is that true or false? The levator ani is one of the muscles of the pelvic diaphragm. True or false? Well, the answer is true, and here it is. You can see it's sort of like a bowl-shaped arrangement of muscles hanging down in the pelvic bone there. And there are actually two muscles that form the pelvic diaphragm. There's the levator ani and the coccygeus. And what I'm going to do is turn the pelvis round ever so slightly so we can see an inferior view. And there it is. You can see it in all its glory. And to me, I don't know if it's just my childish sense of humor, but to me it looks like there's a face staring at me from the pelvis. How brilliant is that? So there are three muscles, or three groups of muscles, that form the levator ani, and we're going to take a look at them. So firstly is the puborectalis, which is different between men and women, and the next one is the pubococcygeus. Next one is the iliococcygeus. And finally, there's the coccygeus itself. Now, tell me that does not look like an alien staring at you, shouting at you with his slanty eyes going, ah! That helps me remember it anyway. I hope you've liked this quiz. We will be doing more, and I would love to, please write some comments below and let me know if it's been of any use. If you like the format, we'll stick to the true-false format. Let me know if it's too many questions, too few questions, and we can tailor things accordingly. Do keep in touch with us through either directly emailing us, or you can go to our Instagram site, which is @FunkyAnatomy. There's daily content that we put out there with quizzes and motivational quotes, and we'd love to hear from you. So thank you very much for taking part in this quiz, and see you next time.